I have done fillers. Will a facelift take that out when it's done? Should I have had the facelift first?
Thank you for your question. You submitted your question without a photo, and you stated in your question that you had fillers done and you're going to have a facelift, and the question is whether you should have done the fillers later or whether the fillers will be affected or taken out by the facelift. Well, in the absence of more details, I can just basically give you some general concepts that I think are maybe helpful to you in understanding what the impact of the facelift is on fillers depending on where they're located, as well as what roles fillers have, especially in the context of what a facelift does. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Facelifting surgery and the use of injectable fillers is a routine part of my practice, focusing a lot on facial aging and helping my patients get optimal solutions based on treatment plans that make sense for their situation. So, when it comes to facelifting surgery, the principal goal of a facelift is essentially to lift sagging tissue, which means typically bringing up some of the cheek area, improve the jawline definition, improve the neck angle or neck definition. Now, we understand very well that facial aging is not just sagging, but it's also volume loss. And volume loss is accentuated or emphasized in bone structure. So bone loss is a very big part of volume loss. So which is one of the reasons I explain to my patients is you can be someone in their 60s and 70s, and no matter how good your facelift is performed, you're not going to look like somebody in their 20s or 30s. Volume loss. Now, in terms of what's going to happen to fillers, well, fillers are placed at different levels and for different reasons. So when you think of the area that the skin is lifted during a facelift, if you had fillers in those areas, they can certainly be impacted not necessarily directly by the facelift, but also indirectly. Swelling, fluid, healing can, of course, affect the effect of those fillers. Places such as the dermis, or the actual skin itself, where fillers are often placed, will not necessarily be impacted, especially in the areas that would be elevated in the flap of a facelift. Usually this means placement around the eyes, placement in the under eye area, the lip area. So it just really depends on where those fillers are placed. It's also important, I think, to understand that beyond the facelifting procedure, and regardless of the technique can be anything from a minimal short scarf facelift to more extensive face and neck lift with platysmoplasty and more extensive skin removal and dissection. But in the end, what you're doing is restoring the position of the tissue. I think that what I explain to my patients is once everything is healed, you can decide whether or not you also want to address areas where there is still going to be some volume loss. Typically, this includes the area of the mid-face, such as the cheek area, as well as in the chin and even the jaw angle. Patients come to me who have had, let's say, facelifts done elsewhere, and they'll say to me, I think that the doctor should have tightened me more because I still feel like I don't see what I want to see. And I explain to them that the skin has a certain amount of elasticity, and that elasticity will always equilibrate, which means that even if the doctor does it as tight as is appropriate, and I think most very competent facelift surgeons will of course do that, then a certain amount of stretch will always occur. Why? Because the skin has a certain amount of elasticity that is age-related, as well as just normal movement. Whether you turn your head, look up and look down, the skin will stretch. but the volume loss at the bone level is an area where there's opportunity. So for example, we do something called structural volumizing. And in structural volumizing, we actually place the volume at the bone level. And so by putting it at the bone level between the bone and the muscle, it could be argued academically that the filler would be less likely to be affected. We can even do certain hybrid procedures where you do a limited facelift and you could place volume at the same time. That's less common in my practice, and actually what I do more commonly is combine placement of filler in the cheek area with eyelid surgery. But so there is a lot of finesse and a matter of really what kind of outcome we are interested in achieving. But as far as the destiny of the fillers that are already placed, I think it's less likely to be that relevant because of the purpose of the facelift is very different from the goal of the placement of injectable fillers. And there's a harmony that can be achieved between these two strategies. So I wouldn't say that what you did prior is actually going to be wasted, but understand that beyond the facelift, there will probably be also opportunity, especially in areas which the facelift does not address, to also still do fillers for the purposes to optimize your appearance. So I hope that was helpful. I wish you the best of luck. Thank you for your question.